Good afternoon, everyone. Thank you for joining us for our Lounge and Learn series. We certainly hope you're tucked inside, cozied up on this new reminder of winter, our winter part 2, right? So we're glad to have you here. This is part of our Lounge and Learn series. I'm Dr. Kenneth Olson. I am the clinic director here at Anodyne Pain and Wellness Solutions of Aurora, and I'm joined by Dr. John Konopolsky, our advanced nurse practitioner, who also has his doctorate in nursing. So we're ready to get started. We're ready to talk to you today about natural solutions to knee pain, or non-surgical solutions to knee pain, or what we call our K.N.A.P, K-N-A-P, our knee arthritis program. I'm going to turn it over to John to say a few nice, informative things here, and we'll get started. So John, take it away.
All right. Hi, everyone. Again, I'm Dr. John Konopolsky. I'm a nurse practitioner with Anodyne Pain and Wellness Solutions. You know, throughout the years that I've been with Anodyne, probably knee pain is one of our biggest concerns that patients have. As we get older, our knees take a beating. You know, the wear and tear, it impacts our daily lives and all the things that we do. And people compensate. You know, they tolerate for a long period of time before they finally decide to do something. You know, maybe you avoid doing stairs, or maybe you don't go to the store as much as you'd like to, or spend time with your family and friends as much as you want because your knees can't take it. And you want to try to avoid surgery. And I can understand that completely. And that's where we want to try to come in and help. You know, we have helped many people have functioning lives, being able to do the things that they want to do with avoiding surgery. You don't have to keep tolerating it. You don't have to be martyrs saying, oh, I'm just old and this is something that happens. No, you don't have to do that. There are solutions. And Dr. Olson has been helping people for many years. I think he's been doing this for over 20 years now. He looks a lot younger, but he's been doing this for some time now. And, you know, there's a lot of people who he's helped, and they're having happy, fulfilling lives because of the interventions that we've done. So I'm going to turn it over to Dr. Olson. He's going to talk to you about what we do and how we can change your lives. And if you have any questions, at the bottom of the screen, there's a place that says chat or Q&A. You know, feel free to type in something there, and I'm going to be here too. I'll answer questions as they come up, or we'll probably wait till the end so that we don't interrupt you know, the flow of everything. So Dr. Olson, if you're ready to take over.
Yeah, thank you, John. And yeah, just a couple of refreshers on the logistics. So on your bottom control panel in the middle is a button that says Q&A. You can click on that and type in any question as we go. I'll be paying attention to those, John will. And then if you go to the far right-hand side, there's 3 dots that says more. There's also a chat button there. So you can go ahead and click on that and type any questions. If you want that to only go to one person, you can change the 2 and just send that to one person so that not everyone can see it. But you know, this is a webinar for you. We do these to help our patients, you know, just gain awareness and knowledge of what options are out there. I know some of you on board today are people who have been inside of our practice and experienced some of the services that we provide. So this might be a refresher for some of the things you've already done. But please do use the Q&A and or the chat button. We want you to have all the information you need from here. You know, John brought up something really important, which is our purpose. And our purpose is to help as many people as we can get and stay well from a natural first perspective. Recognizing that there's a hierarchy of decisions that need to be made in your healthcare. And we try to do that from a very conservative approach, working towards the aggressive, trying to do those things that are more natural and safe. So that's really our philosophy here as we go. So we talked about this. Today's feature is knee pain and really giving your knees a nap. So if we can knock down the discomfort, improve your function, our patient's quality of life really starts to improve. Now, you're not alone with knee pain. Knee pain is 25% of adults have knee pain at some point. And it is the most common form of arthritis in people over the age of 50. So it is a very common arthritic process or a common dysfunction that people see. We are now seeing 80% of people have some sort of limiting factor of arthritis in their overall lifespan, and most of those involve the knee. So what we're going to talk about a lot today is OA, or osteoarthritis, also known as wear and tear arthritis. So this is when the cartilage and the soft tissues start to break down, which then starts to alter how the bone works and how the joint itself starts to work. It's important to understand that knee pain is often not just knee pain. We see knee pain show up in hip conditions. We see it in low back issues. We see it in foot and ankle issues. And then arthritis is generally not just arthritis. So we'll see things where there's ligament damage or meniscus damage and tendonitis and bursitis. So all these can be congruent with osteoarthritis. And it's important that you work with a provider who's diligent enough to really look at the condition and define a treatment solution that's specific for you. We often talk about the knee is trapped between two crappy joints, the ankle and the hip. So in our office, being an integrated model where we look at you as one person, we can address your hip and your ankle at the same time that we address your knees. And it's important to understand that chain, because so many times our knee patients go to a knee doctor, they do one particular thing for the knee feels better for a short period of time, but then turns into a bigger problem as time goes on. And some of you probably have experienced that. So it's important to understand that there's a whole chain of events here. And this is kind of like the old song, right? The leg bone attaches to the hip bone. And we can sing that all day long. But it's important that your providers pay attention to that as well. So what is osteoarthritis or arthritis? So we have this really amazing cushioning on our bones, and that's a very protective mechanism to help add glide and add free movement through a joint. And sometimes that protective coating starts to wear down. And as it wears down, it deteriorates the integrity inside the knee. So there's less fluid in there. We start to see raw exposed bone. We see little bone spurs that start, and we get that gritting, grinding in the knee, which leads to the breakdown and wear and tear. It's important to understand when we look at how arthritis starts, we should consider that when we look at what is the treatment solutions, like what are we going to do to help that feel better. Okay. So osteoarthritis is a common degenerative disorder. It is degenerative, meaning it happens as a result of wear and tear. And it's characterized by both structural and functional degeneration. So we'll see alignment and structural changes. But more importantly, to most of our patients, we start to see functional loss, where patients can't do particular things as well as they used to. They have a difficulty going from sit to stand, or going upstairs or downstairs. So they have a hard time getting moving after periods of inactivity. They have difficulty with stamina. Or they can't walk or move as easily. So it really will start to affect the quality of life. Now, there's two major factors that contribute to how fast we're going to go through arthritis. And one is family history. And just think about this. We can't change your family history. But if mom had arthritis and dad had arthritis, and you have this family awareness, I think it's all the more important that you be proactive about doing everything that you can to maintain your own quality of life. So even if you have a family history, to me, that should just create a mindset to go, I need to take better care of my knees because I'm more likely to develop arthritis. And then the second most common predictor of whether or not we're going to go through arthritis, and especially of the knees, is unresolved stress or injury. And stress can be repetitive stress, right? Just having played a lot of sports or been physically active, or maybe have been overweight most of our lives, maybe not have been as well conditioned as we should be, or traumas, slips, falls, slam dunks, car accidents, skiing accidents, where there was literally changes in how the knee functions. Those are all going to lead to compensation, alignment issues, and that's going to increase the rate of breakdown. So I really like this picture because it shows us what happens as we start to break down in arthritis. And really, a reminder here is that arthritis is a soft tissue issue. It's when the connective tissue starts to break down. And that's important when we start to consider how are we going to treat this. If it's about the cartilage breaking down or drying up or not having enough lubrication or the meniscus not having enough fluid or the ligaments not being strong enough, we have to keep that in mind. Because if that's the breakdown, then we look at the inverse is how do we actually start to treat it to make a long-term impact? And so a lot of our treatments in our office are natural first. So they're not just about changing your perception of pain or putting off the ultimate, more advanced procedures. It's about, can we really restore function? Can we add more lubrication to the joint? Can we heal the growth membrane? Can we repair the exposed bone and recoat that? So the arthritic process is really when this protective coating starts to wear down over time. It leaves this raw exposed bone. That's going to generate inflammation. Inflammation drives pain, and then it erodes the articular surface even more. So it's really an ongoing progressive disease. Those of you who are on now, no matter where you're at in the process, meaning if you're really advanced knee pain or it's just starting, the most important thing to do is get help today. Like, make sure that you are doing something today to ensure that it doesn't get worse, because these types of conditions get worse over time. Okay. So arthritis can affect any joint, but it is really more common in the larger weight-bearing joints. So we see it in the knees and hips and spines, and then the joints that we use all the time, like our hands. But knees is definitely one of the most common. And again, it counts for about 80% of the global burden of disease. So it is a really, you're not alone. You're not alone, and we know that you're suffering. Now, this particular image shows us, I really like this scale. So I believe, and we believe, a foundation of your health is that your body has the ability to heal and repair. Let that sink in. Your body has an ability to heal and repair. The issue is as damage goes on, as wear and tear goes on, as we ignore some of the earlier signs and symptoms, the destructive process starts to be more of a burden than your body's ability to create healing and repair. So our number one objective through all of our treatments is, can we slow down the destructive process and can we improve the reparative process? If we do that, not only do you feel better, but you function better. And when you're functioning better, we're also delaying the progression. We're delaying this thing from getting worse, okay? So we still use X-ray to determine how severe your arthritis is. That's our number one diagnostic tool. But we can also use MRI or other advanced imaging. And then osteoarthritis is broken down into 4 categories: normal all the way to severe. Now, we treat in all of these categories. So even if you're normal, our goal would be, let's keep you there. How do we prevent you from getting from the destructive process advancing? If you're mild, there's particular protocols to help reverse the damage and keep you in a healthy state. A lot of our patients start to show up and they're either in moderate or severe arthritis, because let's be honest, pain's a big motivator. So a lot of people won't start to take care of themselves until they're in pain or have seen severe functional loss. If you're in that state, that's okay. We're going to work really hard to get you back to the best we can. But if you're not quite there yet, I want to encourage you to seek help now so that we don't go there. And our whole mission is, can we improve your body's healing process so that the destructive process isn't as advanced? So, historical solutions. What do you find are historical solutions to knee pain? If you go to your orthopedist or you go to your general physician, what are they going to tell you to do? Generally, it's, hey, lose weight exercise, do anti-inflammatories like Aleve, Advil, Motrin, ibuprofen. They may have you do injection therapy. Oftentimes in the medical world, these injection therapies are steroids. And unfortunately, steroids produce a very immediate relief where we go, yes, we feel better, but often don't do anything to change the wear and tear pattern. So we tend to get worse. And then in traditional treatment, this progresses into and says, hey, Mrs. Smith, Mrs. Jones, whatever, we really think that you need to go to total joint replacement. Now, so many of our people attend our webinar because they want a non-surgical, non-opioid solution. So we added in blue here, this orthobiologics. These are regenerative tissues. These are natural injectables that help create healing and repair. And we also elect some other injection therapies that are natural, that are non-steroid, that can help lubricate the joint. We can look at natural anti-inflammatories. We can combine physical therapy and exercise, and we can do all of these together collaboratively and cooperatively to help get our patients a better result. That's where we find an incredible improved outcome. Now, just to touch, I just include this. These are just some of the medications that people have come in on as a result of their knee pain. And the red ones are those that are narcotics, those that have the addictive properties and kind of are really taxing on the body. So we want to, as much as we can, so many of our patients just want to stay away from that list. And then again, we touched on the steroids. We want to just be aware that steroid injections, while appropriate to put out an immediate fire, are generally not a great consideration for long-term treatment of osteoarthritis of the knee, and can have all these side effects, right? So you just need to be aware of that and make sure that you're asking the right questions when it comes to that. And then surgery. So we want to avoid surgery as long as we can. Not that we're anti-surgery. We just know that so many people want a non-surgical solution. So we just highlight a few of the reasons that people seek a non-surgical solution. One is cost, 2 is the recovery, 3 is the pain, and then the limiting time frame in which replacements last can only last maybe 15 to 20 years, depending on the type and the style and the person. Okay. So here's our point. We believe there's a better way. We know, as John alluded to at the start, we've helped thousands of people get relief from their knee pain, improve their quality of life, get back to doing what they wanted to do, whether that was play more golf, exercise, travel, play with the grandkids, travel away from the grandkids. Our process is about identifying where the source of problems are and rebuilding the patient so that they can get back to doing what they want to do. And we do that comprehensively. We believe that a multifaceted approach, doing more than one thing at the same time, can help people feel and function better. So many of our patients they went to the ortho, they went to physical therapy, they went to chiropractic, they did injections over here, but they didn't do them collaboratively or under the same roof. So our plan is really to go X-ray from outcome. Let's initiate the initial intake and let's work to get you a complete solution to your knee pain. So that's where we came up with our knee arthritis program. It's really about giving your knees a nap, knocking down that pain, getting them restored, and adding your quality of life back. So I'm going to go ahead and play this. Hopefully, John or Nate, let me know on the volume here if this works. This is just one of our patients who wanted to share his experience with what we do.
Yeah, unfortunately, we can't hear it. No, we got nothing. It's really, really muffled.
Okay, I'm sorry, Nate. So you said you cannot hear it?
Correct. We cannot hear it.
Okay, I'm sorry. So I'll summarize for you. We got to figure that out. So Marcus says, he had a couple of knee surgeries prior to coming to us. And although they were necessary because he had traumatic injuries, because of the change in biomechanics, he was starting to get a lot of arthritic change. And through our process of appropriate alignment, regeneration using our regenerative products, and then appropriate strengthening, he's regained his full function, and he's going to go ahead, and he was actually doing a move that day. So he was showing us that not only did he feel like he felt better, but now he is able to move things, lift things, and perform tasks that he would like to be, that he wasn't able to do previously. So I ask you, what's missing in your treatment plan? What's missing as part of your treatment protocol? What's not being addressed? We feel like we have a full suite of services that can fill this gap. So we really look at multiple steps to helping you feel better. And one is creating healing and repair. And that's really about creating regenerative therapy. So some of you have heard of stem cell therapy or regenerative cellular therapy. We have lots of options to help here. And then visco supplementation. These are the gel shots. Some of you may have heard of these as the rooster comb shots. These add lubrication to the joint and add cushioning. And so we have a full suite of services there. And then our rehabilitation program is really quite unique. And we base that off of SANS, which is stabilize, align, get your muscle control back, and then strengthen. And then lastly is getting you back to what you love to do. So sometimes what that means is we have to look at the secondary areas of concern, whether that's a low back or an ankle or a hip, so that those secondary areas are addressed, and you then can proceed and do the activities that you really like to do. So when we talk about healing and repairing, remember your body has an ability to heal and repair. The unfortunate aspect is as we age, we lose some of those resources. So we run out of some of those resources, and we need added healing to our bodies. So we have a full spectrum of stem cell and regenerative options all under one roof. And regenerative medicine is this a paradigm shift from conventional methods that say, hey, let's knock down pain and eliminate your symptoms, to really going, hey, let's use resources that promote healing and repair to trigger your body's own ability to complete that process, including cell and tissue engineering. Based on today's timing, I don't want to go into these too great a detail, because we'll address these on an individual basis based on what you need. But we do have really 4 major regenerative options. One is called PRP, that's using your own blood, and it's relatively less expensive. It's readily more available, but it's only about 6 to 7 times your body's own healing. Where when we look at amniotic tissues, this is donated amniotic tissue that is thoroughly screened and has this very unique biological matrix that creates healing and repair. So it's a very young source tissue that recruits your body's own stem cells. And this is 100,000 times more consistent than PRP. So it really gives us a tremendous amount of healing into an injured area. And then Wharton's Jelly is one of our products that, again, is donated tissue, but actually has live viable mesenchymal stem cells, and not only creates the cells, but creates the structure in which your body needs in order to create healing, what we call a scaffolding. So the scaffolding literally allows for the expansion of that tissue to grow. So, and that's about 50 times more healing potential than amniotic fluid alone. So these kind of work in progression as far as their strength. And, there is some increased cost here, but what we do is work with each patient to identify what exactly you need, and then come up with strategies that are specific to you. And then the last product in our regenerative medicine option is exomes. And these are little micro acellular vesicles that promote cell-to-cell communication. So essentially, tell your body's new cells to live longer and to duplicate your healthier cells faster. And it helps die off your old cells. So we really get a real cell repair and healing. The beauty of exosomes is they can be injected into a joint like a knee, or if you have systemic inflammation or widespread arthritis, we can also push these throughout the body through an IV. And so we're seeing patients who have advanced arthritic changes do really well with an IV push and then a treatment into their specific knee. So again, if you have questions, make sure that you jot them down. If you have specific interests in a particular product, Emily's going to work with you to let you know how we can continue the conversation with you individually. I'm not seeing much action on the questions yet, but please do so. We want you to have the information that's specific to you. These regenerative products are amazing and really can help create the healing that we need. And then that cushion and lubrication, let's be honest, we all know that we lose that lubrication over time. And so hyaluronic acid or these gel shots help maintain that lubrication. And we have multiple products that we use to build that lubrication up. Dr. John's amazing at his ability to inject those into the right spot. And what this does is essentially is a lube job for your knee. So it reduces the grating, grinding, helps coat the knee, and then that complements our therapeutic approach. Some of you probably have been through gel shots previously. Oftentimes what we hear is people go, yeah, I went through gel shots, but they didn't work. And maybe they did a 1, or maybe in some cases they did 3 gel shots, but they did nothing else along the side of that. They didn't do any bracing support. They didn't do coordinated or collaborative physical therapy. They did no regenerative process. So I encourage you, if you've been through gel shots and they didn't work, give us an opportunity to look at your situation and see if a more comprehensive approach would help. Oftentimes, gel shots alone are not going to make the difference. We do need to work on the other contributing factors that are creating the wear and tear, such as alignment and stability and muscle control, and maybe even some additional healing. So the 2 main gel shot products that we use are Hyaluronic, which is an all-natural and can be a series of 3 to 5, and then Ginvisc 850, which is also a variable dosing. So that can be either 3 or 5 in most cases, because most patients are coming to us in that moderate to advanced OA. We do a series of 5. And so there's what we find is that with the gel shots and some appropriate other interventions, we can see people that get really good results over a longer period of time. These are not going to remove your arthritis. They're intended to help treat and minimize the wear and tear of your arthritis. We do recommend that both of these be repeated or at least evaluated for retreatment at 6-month intervals. They can be repeated at 6 months. And the idea is to just continue to keep the lubrication in the knee so that we have less wear and tear. And the research does show that this will punt the necessity. It'll move the necessity for total knee replacement down the line while maintaining your comfort and maintaining your quality of life. And so that's what we really look at doing. And then our approach to therapy is very systemized. Again, we want to stabilize the joint. Oftentimes what we see with our patients is the patients not only have the compressive forces of arthritis, but they're getting the shear forces. So the joint's sliding right to left, and that creates a grating, grinding effect that makes the arthritic change and the wear and tear even worse. So we need to stabilize that joint first, then we create alignment. We either do that through physical therapy, through manipulation, or through bracing. And then neuromuscular control is about reteaching your body how to use the muscles to stabilize and feel comfortable with normal motion and movement of that joint. And then we strengthen, okay? One of the biggest advantages of us as our physical therapy department is here, and they work side by side with our providers. We meet every morning to discuss patients so we can really create a very collaborative and integrated approach to care to accelerate your healing process. So, and that's, the counterpart of that is being sent out to a third party physical therapy department where there's not collaborative effort. And we've all heard that, you're kind of treated as a number, or that your treatment's not very specific then, or there's not coordination back to the doctor about what's happening. So we really work to ensure that everybody knows how you're doing, what's going on with you, how we're going to alter your treatment plans so that we can get you the best result. And that's what we do together. So one of the studies reported that 60% of patients with knee arthritis reported knee instability, and the knee joint is stabilized by a combination of static and dynamic stabilizers. So essentially what this said was that in knee pain arthritis, it wasn't just the arthritis, but it really was the instability, both of static and dynamic motions. And if we didn't stabilize those, the patients didn't do better. So we really need to ensure that we're customizing a rehabilitation program that really gets you the results that you need, and we're able to alter that on the fly. And that's exactly what we do here at Anodyne of Aurora. So, and the beauty of that, as a chiropractor, I feel like our chiropractic assessment is critical to that as well. So if we can improve the alignment of the spine, the hips, the pelvis, we can lessen the load onto the knees, we can reduce irritation off of the nervous system, and we do that while complementing improving both the neuromuscular control and the alignment. It'll really go a long ways to create that stability that your body needs. So, in general, we just feel that there is a much greater outcome to a collaborative approach. And Dr. Desi, our doctor of physical therapy, has done some great research on that. And we're finding that patients are getting somewhere between 12 and 15% faster rates of improvement with a collaborative care plan than they are with standalone physical therapy. So we're really excited about that. It just proves that our model gets patients a more complete and more effective result. So there are multiple mechanisms in which back pain can affect the knee, but in part it's about the interrelationship of the loading mechanism. And it really takes a skilled assessor to understand that. Chiropractic care isn't just for your spine. So we can work on your knees, we can work on your hips, we can work on the ankles at the same time. And the idea is, like, can we really address all of the interrelated issues that might be affecting your knee pain to get you a sustained long-term outcome. We also include muscle work and muscle manipulation and muscle therapy and massage therapy in conjunction with our coordinated efforts. So massage therapy can improve your flexibility. It can improve the blood flow to the injured area, and can improve your strength and stamina. So we'll actually even see that our patients gain greater ability to walk longer distances and better range of motion, even with immediate response after their massage therapy visits. And then we use some specialized techniques in that manual therapy. And those would be prescribed very specific to you to help break up, the compensation that your body creates from walking, with a guarded or kind of compensating pattern. Your body's going to build up these adhesions within the muscles and restrict motion and movement, and that's going to complicate your response to other interventions. So doing good specific muscle work has proven to be very effective here. And then we do look at the appropriateness of bracing. Not that we want you in a brace long-term, and not that we think a brace is the solution to your problem. It's not. But oftentimes bracing can help offload the damage, can reduce the wear and tear to allow us enough opportunity to create the healing that we want. So sometimes we've seen our patients be given this big offloader brace that they'll never wear. That's generally not what we like to do. We want to get somebody in the lowest profile, highest degree of function support or brace that we can. And then we coach you through the time frame in which to use that so that it's complementing our other healing process. And then functional conditioning is really about getting you back to the things that you love. I won't share, I don't think the audio is going to play on this, but Vicky, Vicky goes and essentially Vicky was a person who walked in here on crutches and was unable to do most of the things that she wanted to do in life. And within about 6 months, Nate, can you hear that?
No, there's no sound.
Okay, we'll have to get that embedded, right? But anyway, she says she walked in with a walker, and over 6 months of care, she avoided total knee replacement, avoided any surgical intervention, and was then able to get to the point where she was walking around quilting and quilt shows and those sorts of things unassisted. And she was walking for 4 and 5 hours a day with only minimal fatigue and discomfort. And she utilized our whole suite of services. So she went, we did a regenerative process, then we did the cushioning and gel shots while we did physical therapy and alignment. And we did some chiropractic care work with her. So she really did well with our whole functional process. And that whole process really follows this flow of care. It's really about getting you out of pain, getting correction, improving the stability of the joint, strengthening, and then some of our patients choose to do wellness care. So our ideal is to take a very systematic approach to help you feel and function better. So by those of you who are on, are there any questions? Does anybody have anything that we have not covered here? I'm not seeing any on there. So the beauty of our office is we have the ability to perform all of those services all in one roof, and we're going to do it with a caring and compassionate approach to care. And I just ask you, those of you who are suffering with knee pain, are you willing to accept our gift? And our gift is this: it's the opportunity to come in and sit down one-on-one with our providers and really look at your particular situation and see if our suite of services is the right fit to help you feel and function better. Emily's going to reach out to you directly. Again, this would be our gift, so there's no cost. We'll sit down, we'll evaluate your particular situation, look at what you've been through in the past, we'll look at how you're functioning today, and make a determination if you can do better in life. If you could feel and function better, would you want to? And if not, I would ask why. So Emily will be reaching out to you to do that. I encourage you to come in and sit down one-on-one with us and give us the opportunity to help improve your quality of life. So this is our team. Those of you who haven't met us, we have a great caring staff who are here to help you really address your individual concerns. And I think a unique thing about our practice is we make our providers meet every morning, and we meet and discuss what's happening with each patient and how we can best help them. So John, do you have stuff to add?
I had a couple of thoughts. First of all, I am really, really grateful that you did not sing. We were discussing knee pain, not ear pain, and that's another webinar we can do. But no, I am grateful for that. I just want to tell people that there's no magic pill, there's no magic needle or shot, or it just takes commitment, and it takes a team approach to help your knees get better. People think it's the knee joint, that's the problem. But the knee joint is more a result of other things that have been going on. And that's where this team approach that we have using chiropractics, medicine, and physical therapy, that's where it makes a difference. Many people go to other places and, they stick them with a needle and say, okay, we'll see you in like 6 months, and nothing changes. It's like, no, we want to make sure that you are getting better. We look for your feedback. Um, if you're not getting better, we try to problem solve to come up with ways of making it better. And the other thing that people need to remember is, if you have knee pain right now, it's not going to go away by itself. When we were younger, and we took a fall or something, it was sore, and then a week later, okay, we're better, we can function. At this point of the game, knee pain is not going away by itself, and the longer you wait, the less options that are available to you. And then it's harder to recover as well. So it just makes sense to come in and have it checked out and see what's going on. And your knees could be bothering you, and you could be saying, I'm also having back pain. That could be a result of your knees. So have someone take a good look at you and evaluate the big picture, and then come up with a plan that works for you, that is customized for you, that's going to help you feel better, and to get out there and play golf or play with your grandkids, or just to go out with your friends and not be in pain all the time. So yeah, I think that's good. And I promise you, unless you ask, Dr. Olson won't say.
Thank you. What I'm going to do right now, just to open this up, because it seems like maybe there's some shy typers. So I should have allowed you the opportunity to ask questions. Are there any voice questions that anyone would like to throw out here, or comments?
Can you hear me?
Yeah, go ahead.
Okay, I've been through your program. I've had knee pain, I've had low back pain, and I'm better, and I think I'm just about ready to, to stop the program. But what is the one thing that I can do to keep it at a steady pain level, or no pain at all at home?
Yeah. So I think that's a great question. And you've done great with what we've asked you to do. And I think, as you mentioned, you're much improved from where you were, right? So the number one thing that you can do at home is motion is lotion, right? So keep moving. So your home exercise and home movement program is crucial. I think also when we're in a more advanced stage, I think keeping connected to some level of care. So looking at supportive or maintenance care is really important, so that we keep alignment in a good position. We address small issues before they become large issues. So your home care, your home movement, I would stay on supportive, stretching and manipulation care, maybe manual therapy, and we can talk to you about exactly what that looks like for you. And then lastly, for the knees, is really look at doing the gel injections at every 6 to 9 month intervals, just to ensure that we keep the lubrication effective and at a level that reduces wear and tear.
Okay,
Does
thank
that
you.
make sense?
Yes, it does.
Cool, great question.
The other thing that I would add to that is proper body mechanics. When you're lifting or when you're moving, that you make sure that you're straight on to whatever you're doing. A lot of times we're seeing patients, their injuries will come from they twist to grab a grandchild, or they lift something without, thinking about it, and that ends up hurting them. So, and if you're going to go for a long walk, or you're going to be out doing activities for a long period of time, that's where a brace might come in and give you that extra support and extra stability. It's the unpredicted events that can end up hurting you. And that's why it's always important to think of body mechanics before you engage in an activity.
Great point, John. I agree. Other questions? Where'd they go?
Mm.
All right. So. I don't know where my- So those of you who joined us today, I really thank you for your time and attention. I hope we were able to answer some of your questions. You learned some new information. Emily will be reaching out to you either via email or phone if you provided it, to give you the opportunity to see if we can continue the conversation. As we indicated, I encourage you to take action. Don't let your problem get worse. Don't buy into the idea that you have to live with pain or functional loss. The best thing we could do is dive into it and see if we can help you improve your quality and quantity of life. So I appreciate all of you being on today, and I wish you well. Thank you.